Hello, my name is Dr. Kavian Malani. This is Medical Updates. Today the topic is going to be prostate cancer screening for the general population. The issue of prostate cancer has been an issue that has been debated in the literature for a number of years now, at least since 1996, when the United States Preventive Task Force came out with a D recommendation against the cultural and the push by the American Urological Association and other organizations to do PSA screening. They came out and basically recommended that there's probably not good evidence and probably the test for PSA should not be done. In general, prostate cancer is a fairly common cancer, but there has been some controversy and some debates in the literature that has to do with the screening. Obviously, prostate cancer is a tough disease, it's a difficult disease to catch, and it's a disease that is difficult to actually treat if it is spread beyond the prostate capsule. The difficulty is that also prostate cancer is a difficult disease to die from because it does have and does involve metastases spread to the bones that are very painful. And so ideally, you want to have patients that have prostate cancer screened in a way that if they're going to pass away from something, they pass away from heart attack or some other illness as opposed to having to die from bone metastases. I've seen some patients die from bone metastases, and it is a difficult process. So my recommendation is that people should be discussed and talked on the issue. Basically, it turns out that people would be interested, and over the past 20 years, there's been a fair amount of improving in our cultural understanding of the importance of this dialogue between the providers and the patients. The American Urological Association definitely pushes for aggressive screening by digital rectal exam and by basically PSA. The other groups, like the American Academy of Family Practice and United States Preventive Task Force services, definitely fall on the side of discussion with the patient and recommending against screening for prostate cancer. Now, we did talk about this issue one time in our previous session a number of months ago, but there are some updates on this issue that I do want to address today. The first thing is that the PSA screening is very unreliable. It does have a very high false positive, and it does have a very high false negative. And so a test that's positive doesn't necessarily mean cancer, and a test that's negative doesn't necessarily mean that you're free of disease. The digital rectal exam is unreliable, it's subjective, and basically you don't really know exactly what is going on just based on an exam, unless there's an asymmetry or a gross lump or a very significant mass you can feel. Otherwise, it's difficult to tell what's going on. So the combination of two unreliable tests makes it even more uncertain and more unclear as to what to do. The number of groups in the area now are actually recommending either lasers or radiation, cesium seeds, or other mechanism for treatment. At this point, I definitely recommend that people, if the PSA is positive, move towards a biopsy. If the biopsy is positive, then I still recommend a surgical excision of the prostate with the capsule and using a nerve-sparing techniques. A number of academic centers and a number of physicians locally do this, and that is a very, very good way of trying to manage symptoms and minimizing after effects of the screening and of the testing and of the surgery, which includes basically difficulties with sexual function and urinary incontinence. The most important thing about the PSA testing is there has to be kind of a significant dialogue and discussion by the providers and the patient. And I encourage everyone to study the detailed analysis that United States Preventive Task Force Services has provided, which basically does include guidelines on how to talk to people, how to engage people on this issue, and begin to think of a way forward in terms of testing. If you take average 50-year-old men that die in basically irrelevant accidents like car accident, it turns out that a fair amount of them, about 50%, have actual prostate cancer, microscopic or growths in their prostate. So basically, a lot of men do develop prostate cancer. Not all cases actually lead to overt prostate cancer or cause death. So the question really for research for the next few years is going to be to figure out how to discover, how to figure out this particular group and how to begin to isolate this data in order to deliver better care. So again, the issue here is one of very live and lively debate and discussion. It turns out that there are no kind of very clear-cut answers. However, we do know that basically there's time for the patient and the doctor to sit down together and discuss the outcomes and then go over some literature, and this is a fantastic area for some additional studies to be done in the next few years. Thanks for watching Virginia Medical Updates. Please feel free to contact me at virginiamedicalupdates@gmail.com, and don't forget to like and share our video on YouTube and Facebook and Twitter.